All right, so right now I am joined with Dr. Bansal, and we are inside Mercyhealth's Advanced Primary Stroke, one of your many procedure rooms that you have here that your stroke team, works out of. So we're going to do kind of a little walkthrough,
Sure.
and I want you to explain a couple, because I may ask you completely dumb questions because I've never been in a room like this. And you got to tell me exactly what happens in here. So as we're walking in, you also call this room like a biplane room?
A biplane suite, yes.
A biplane. Oh, it's a suite.
Yeah,
I like
yes.
that. That sounds very nice. Okay, so let's walk in.
All right.
Okay, so as a patient comes in for the appointment, what is the first thing that they do when they come in here?
So the first thing is they'll be rolled into here, into this area on a stretcher, and then
Okay.
we'll transfer them over to the actual bed on which we do the procedure.
Okay.
We call it a biplane suite because these two arms that we're seeing here are cameras, and it gives us visualization in two different planes, hence the biplane.
Okay, so this seems like this is a pretty advanced treatment.
It is. It's a very advanced treatment, and we're very fortunate to offer it to all of Rockford. We have two campuses, and these services we have capability at both campuses.
Okay.
Most of the patients get transferred here for that highest acuity care, especially for stroke patients. And
Right.
we want to remember that we can treat stroke patients for up to 24 hours now, according to the latest guidelines. And that means that if somebody's having a very large stroke, that we're able to go and actually remove the clot from the brain directly. And that timeline, again, is 24 hours. And we use this room specifically to remove the clot. The camera, the screen behind you is actually what we're able to visualize everything on as we're removing the clot. So it's done under X-ray. And so we're able to see everything directly on this screen as we're doing it.
As far as advancements, you were saying 24 hours. What was it before it was up to 24 hours?
In 2015, it was 6 hours. 2015, it was up to 6 hours. Then timeline extended to 12 hours, and now finally up to 24 hours from last known normal.
Wow, that's quite an advancement.
Yes, yes. And this is in addition to the long-standing stroke treatment of intravenous TPA, which is a clot-busting medication that we're able to give to patients through an IV, even in the emergency room. And that's only up to 4.5 hours. So you can imagine the number of patients that we can now treat is much more.
Right,
and the benefit and impact we can have on those patients is much more.
Well, and it happens, it seems like instantly. So they come here and you guys are just in action to get them where they need to be.
Yes, yes. We have 24/7 stroke service available at all times. We're always here in the hospital. Somebody's here as part of the acute stroke team to offer this care.
Well, and after I talk with you, we're going to talk with Dr. Wallery about BFAST and how to notice those symptoms and things that are happening, whether it's a family member out in public, what you need to be aware of for stroke symptoms.
Yes, great.
So thank you very much. Nice meeting you.
Appreciate it. Thank you.
Today we are at the Mercyhealth Javon Bay Hospital and Physician Clinic Riverside, and I'm here with Dr. Wallery, and we're sitting in front of this beautiful, it's called a living wall, right? But what does it represent?
So it's a living wall that represents our two campuses here, both at the Rockton campus and at the Riverside campus. We have the river in between, and the flowers represent each campus on both sides of the river.
You're a neurologist, and obviously we are here today talking about, stroke awareness and things that people should be aware of, or maybe people aren't aware of. So what are signs and symptoms of a stroke?
Yeah, so signs and symptoms of a stroke, we generally use the acronym called BFAST, which stands for balance, eyes, face, arm, speech, and time. And the time component is so important because about 1.9 million brain cells each minute are degraded during a stroke. So it's really important to get to the hospital very rapidly. So when you think about how important some of those cells might be, whether it'll affect your speech, your movement, your ability to walk or live independently. So it's something that we encourage everybody to learn the signs and symptoms of the stroke and make sure they get to the hospital very rapidly.
Okay, so as far as age-wise, is there a specific age where strokes tend to happen more, or is it just anybody?
Yeah, so certainly the older you get, the more prone you are to having strokes. But what's really interesting is that we see individuals of all ages with strokes. So you shouldn't ignore the typical signs and symptoms, even if you're of a younger age. One of the things that I've really been passionate about recently is actually reaching out to the younger population to help them learn the signs and symptoms of a stroke, both for two reasons. Number one is they may have somebody in their family that may have or have signs and symptoms so they can recognize it early, but even of themselves. One of the things that I really like to teach about are the aspects of primary prevention of health.
Okay.
So in our society, about 80% of all diseases can be cardiovascular, heart disease and strokes can be prevented if we just manage our primary risk factors of stroke. High blood pressure being the #1 risk factor, cholesterol. Exercise is really important. There's a program called Exercise is Medicine, which recommends 150 minutes a week.
Okay.
So, which really isn't hard, but it's sometimes hard to get motivated through that for individuals. We don't have the time. But certainly it's something that we need to make part of our everyday lives.
And so right here, which is amazing, the American Heart Association, the American Stroke Association, you're part of the Get With the Guidelines, the Stroke Honor Roll, and it's gold now, gold plus, elite plus. So tell me, what does that mean to the hospital?
So we're super excited about this award. Each year that we've been involved with the American Heart Association program, we've increased our level of award. And so for us, what this really means is that we've established the highest quality care that you can possibly give to patients. The second part of that is really talking about our ability to rapidly treat strokes when people do come in. Because other than recognizing the signs and symptoms, the second part of that is what happens when you first come into a hospital.
Right, what do you do?
Right, so we have a couple different therapies that we can do emergently. The first one is what's called TPA. It's a medication, we also use the term kind of a clot busting medication.
Okay.
It's almost a Drano for the blood vessels, so we hope that it can break up a clot.
Gets it out and keeps
We hope
moving.
it gets it out. And that second part of that is if we do see a clot or something that we can reach up and grab, hopefully we can get up and do what's called an interventional procedure, which means that we'll guide a wire up and see if we can grab that clot and pull it out if you come in with a certain time frame. Generally for TPA, it's within 4.5 hours for most population.
Okay.
We've now extended the time window out for a lot of the interventional stuff, which is up to 24 hours. But the earlier the better, because remember, it's 1.9 million brain cells a minute. That
number is staggering to me. Well, thank you. That was easy, wasn't it?
It was easy. Thank you
All
so
right.
much.
So Mercyhealthsystem.org is the website you can check out. We'll be right back with more Good Day State Line.